Hi, I wanted to review this little thing. This is called an aligner. Everyone should have two of them in your box. So, what is this thing for? When we move your jaw forward, most of the muscles are being stretched. There's one that is being crunched up. That muscle causes a lot of issues. If you were to take your appliance out and squeeze and stretch and all that, it's like if you were to wake up after crunching your arm all night long and then all of a sudden go, ugh, and it would cause pain. So we don't want you to do that. In the morning, what I want you to do is take your appliance out gently and then put your tongue between your teeth. That allows the muscles to kind of relax on their own. You're not forcing anything. Let them relax. That's what I want you guys to do. Now, there's one bad side effect that is irreversible, and that's the lower jaw moving forward permanently. So we want to prevent that. And this side effect happens microscopically every day. So you have to check it every day. That's where this little doohickey comes into play. Every day, before you go to bed, before you put your sleeping appliance in, you will pop this on your lower front teeth and you will bite into it. And we did this with your natural bite. So your teeth should have little grooves like this. Some people have deep ones, some people have barely any groove at all. Most people are going to need to look on the sides here. What you're looking for is that the upper teeth need to fit completely into those grooves. If your upper teeth don't fit completely into those grooves, that lower jaw is moving forward permanently, so you can't get all the way down into those grooves. So, what should it look like? Now, keep in mind, my bite is different than most people's. I'm an edge to edge. Most people have an overlap, right? So, ignore the way mine looks, but I'm just going to show you how it works. So, you put it on your lower front teeth, and you look in the mirror. You have to use your eyes. You cannot go by feel. And you look in the mirror. That is how it's supposed to look. Teeth go all the way into it. If you see any spacing, that's a problem. If you see this, or even that, that's when you have an issue. It's not a big issue. All you have to do is squeeze. Watch. So you see how the teeth go completely into the groove. And again, most people need to look over here. That's where you'll probably need to look. This is going to be the routine. Before you go to bed at night, pop that on, bite into it. If you see that, give it a good squeeze. If you go all the way down into the grooves, take it off, rinse it off, put your appliance in and go to bed. Half a second. If you notice any spacing, you're going to squeeze until you get all the way down in there. If after 5 minutes you still can't get all the way down in it, it's okay. Go ahead and pop it off, put your sleeping appliance in, go to bed, and call me the next day. I hope that makes sense. By the way, you have two of them. We say one to use, one to lose. Don't lose it, but it's just an extra one, a backup. So again, this is an everyday thing. The people that have lost their lower jaw moving forward permanently, that bite, those people thought this was not necessary. Do this every day. It takes half a second. There's no excuse. Bye.